So direct primary care is quite simply a direct relationship between the patient and the doctor. And what I mean by that is that we have opted out of insurance. So I don't get reimbursed by insurance companies. The way we are paid is by monthly membership fees from the patient. So it works like Netflix or joining the YMCA, where you pay a monthly membership fee, and whether you're using that service that month or not, it's going to be the same fee. So what that does is it cuts out the middleman being the insurance company. And so that has really changed the incentives in terms of how our office works. So we work for the patient. And so we're trying to um, set up our office in terms of what makes the most sense for patient care. And what that allows us to do is we have longer visit times. We are very accessible in various different ways, which I'll go through in a little bit. But direct primary care has been growing exponentially over the last 3 to 5 years. When I first went to a conference in 2016 to kind of learn more about setting up the practice, there was in the ballpark of 330 practices across the country. And when I went this summer, there was over 1,000. So it's really growing across the country as more providers are getting frustrated with the current system as well as patients. And so this is a nice fit for both. And when you think about it, direct primary care is not really new. It's kind of like the old town doc from the 40s. I mean, we have a pharmacy and a lab, and it really allows us to take care of the whole patient in the office. We do home visits if that's needed, and we spend a lot more time with patients. So it's a really nice fit, not only for the doctors, but also for the patients. And I like to think of it as more of a value-based model versus a volume-based model. And what I mean by that is by providing all these additional services and the time, we're adding value to the patient experience. Whereas in the university-based model, it's really, a lot of the focus is on the volume, how many patients you're able to get in the door and care for. And although it's important to care for a large number of patients, I think at some point you lose the quality that you're hoping to give by seeing those patients in such a quick manner. So I found for me that direct primary care has worked really well to help navigate that difference there. So what sets us apart? How are we different? And I've alluded to a couple things already, but I think the main thing is we're just a lot more personalized. So every patient's a little bit different, and given the fact that we're able to spend so much time and be available to patients, we can kind of customize what a patient needs. We're accessible by text messages, by phone visits. We always have open same day or next day appointments for patients. Never set up the schedule where we walk in and we have a full jam-packed day. So patients can always call in the morning and get in. And if it's later in the day, we'll make sure we get them in the next day. I've even set up just phone visits, so if we're doing a med check or if a patient just has a question, we can block off time on the schedule and talk to them during their lunch break at work. So it saves them from having to leave their office and drive over, wait in a waiting room, all of those things. We also have portal that we use and have great feedback. Patients love emailing and messaging us through that, and they can see all the records. And then the email visits or even video visits we could do if a patient wanted that. The other thing that we have that makes us a little bit different is we have an in-house pharmacy. So for our patients who are members here, we're able to buy wholesale medications, and we can sell those at wholesale costs or at costs, and that allows patients to save a lot of money. So even our patients who have insurance, who generally use their insurance to pay for their imaging or have copays, they often will come here and buy them because they're cheaper. And the lab has been great. It's very convenient because patients can get their blood work right while they're here, and we've negotiated pricing on that, so it's very affordable cash prices